Hey everybody, it's Ed O'Keefe and welcome to another episode of America's Leading Experts. Today I'm with one of my favorite people, Dr. Jeff Rebarcak of Local Wellness Lounge right there in what part of Arizona?
We're in Mesa, Gilbert, Arizona. We're on the border.
Okay, Mesa, Gilbert, Arizona, and you're also the founder and creator of Shape Up Medical, which is now going nationwide. So super exciting.
Yeah, fun time to be doing.
Yeah, so you're classically trained as a chiropractor, but you're now on the cutting edge of regenerative medicine.
Yes, correct.
Isn't that exciting?
It is exciting, and it's changing so fast.
So fast. So why don't we just dive right into give us the 30-second backstory, and it could be 3 minutes, but you know what I mean, of how you went into becoming a chiropractor, and then take us to just, the miracles of regenerative medicine that are happening, that are becoming more mainstream, but people with pain in their shoulders, knees, all over their body don't realize actually if they're a qualified patient or they should look into it. Yeah.
Gotcha. It's funny too, and you say, give me the 30-second story. I've been practicing 35 years, so about for every decade I'll do it.
You got 35 seconds. Yeah, that's right. Yeah.
So, I became a chiropractor, graduated school in 1990. My dad was a chiropractor for 56 years before he passed away. So it was just kind of natural. I saw him, small town in Iowa. People loved him. Great, I had great upbringing. So something I wanted to do.
Yeah.
I also loved helping people without drugs and surgery. And so got to Arizona in 1990. So the math, a bit older, and opened my first practice. About 5 years in, realized, there's probably more. And so we were one of the first practices in Arizona in 1995 to innovate. So we brought medical doctors, nurse practitioners, physical therapists, chiropractors, massage, everybody under one roof. So we have been practicing that way ever since.
Wow.
The way that I got into regenerative medicine is in about 2010, had a really bad neck incident.
You did?
I did. Had 3 blown discs in my neck.
Oh, wow.
So picture this, I'm a chiropractor. I can't get through the day. My left arm was numb, tingling, I had no grip, can't adjust patients, literally can't play with my kids. As a chiropractor, I'm on medication to get to the day prescribed from me by one of the docs in my office. Going against every principle I've had. I couldn't sleep. I was on medication. I was told by 3 different surgeons I needed surgery. It was a year of misery.
Wow.
It was terrible. I got to the point where I was desperate because I literally could not go any longer. Started to do some research.
Yep.
And that's where I came across, regenerative medicine. It was early back then, 2012 at the time then. So I was, the pain started in 2010. So the time I finally got to regenerative medicine, it was 2012. So
2 years.
2 years. 2 years of pain.
Wow.
Those are 10 out of 10 pain. And it was just totally different because I could start to feel what my patients were feeling.
Yeah, it gave you another level of empathy about this is what people are going through.
Yeah, changed my perception a lot.
And wow, that's interesting.
My compassion, though, for sure. Yeah. Anyway, so back then, it was really hard to get regenerative medicine or stem cell therapy here in America. But I got it done, and the first 4 months, nothing. I had to go to my wife and say, honey, I just wasted a lot of money, because back then it was really expensive. It's not even a fraction of that now.
Yeah.
And that's how desperate I was. I was willing to spend everything I had to get out of pain and not get neck surgery. I don't know if you've ever seen people with neck surgery, but they turn like this when they're done.
Yeah, because the options were like a fusion of some sort, and
and most neck people, I've been doing this 35 years now, and successful neck surgeries, I count on one.
Yeah, it's rare.
It's a rough one.
Yeah.
And you're going to get another one. In this lifetime, you're going to get a second one, probably a third one. And most of the neck people that come to my office post-surgery are still on meds.
Wow.
So I wasn't going that way. 4 months in, 4 months post-regenerative medicine, didn't feel a thing. And then about month 4 or 5, started to kick in. I started feeling better.
Really?
Yeah. By month 7.
So can you explain to everybody just watching, so when you went and spent money on it, what form of regenerative medicine did you, I just want to make sure we're clear, because that's great.
Yeah. At the time, I received stem cell injections from what's called Wharton's jelly.
Wharton's jelly,
Yeah. That's the jelly on my mom's umbilical cord. The baby is out, healthy born baby.
Yep.
No damage to the baby.
Yep.
Usually they take that stuff and they throw it away.
Yeah.
But now labs come in and they say, hey, can we harvest the stem cells out of the Wharton's gel?
Yeah.
There's a particular stem cell that we call mesenchymal stem cells, or MSCs for short.
Yeah.
MSCs have all the good stuff.
All the healing, yeah.
Hyaluronic acids, proteins, growth
Wow.
factors, all those cool things. And so when we take stem cells or mesenchymal stem cells out of the worm's jelly and we put them in somebody, they do what they just got done doing. They just built this beautiful baby, this musculoskeletal system, this nervous system. So I get to ward these jelly injections into my neck.
Yeah.
And about month 4 or 5-ish, it started to kick in. And
it just goes to work. So what's so amazing about stem cells, and this is why I just love interviewing doctors on the cutting edge of this, because it's like, as Dr. Scott says, and he probably got for us, but it's like the power that made the body is the power now that heals the body. So it knows how to go restore, rejuvenate, and heal where there's injury, damage. Okay.
Yeah, it's going to those names.
That's amazing.
It is amazing.
Yeah.
And so it started to kick in for me. It took several months after, 4, 5, 6, 7 months.
Wow.
That was better.
Now, also, what you see in your clinic, if people have not as severe of injuries, they can see results much faster.
Absolutely.
Okay.
Average person 4 to 6 weeks. So
okay, is that what it is? Okay, great.
Yeah, and some people too, severity-wise, I've seen some people really severe get a lot faster relief than
because whatever the mechanism that's causing, whether it's the inflammation, that percentage of relief, because it's so bad, makes a world of difference.
World of difference.
Oh, wow, that's so good to know.
And the way that we harvest stem cells today in lab versus the way we do it in 12, much more effective. We get a lot better final product to inject in someone now. So things are like technology.
Things are evolving rapidly. Yeah, that's correct.
That's great. So for me, I felt better after 7 months. Did a post MRI, and we had noticeable structural changes on the line.
That is unbelievable.
It's amazing. So for me, I looked at that and I grabbed my team, my integrated team. They kind of laughed at me at first because they're learning. And I said, guys, we have to watch how regenerative medicine starts to unfold in there. And so we did. And we started to use it a little bit in 2013, 2014. We were doing something then called PRP, which is where we take our own stem cells. And back then the research was good, still is, but as you age, it's not near as effective. But we were doing a lot of it back then. Yeah. And then as time has gone on, we've just done more and more and more.
Yeah. Can you explain for our audience that you brought this up as we age? There's a reason why fresh stem cells are really considered a better option than PRP nowadays.
Yeah.
Can you also explain why we need stem cells as we get older versus when we're younger?
Yeah. So newer stem cells from Wharton's jelly described are called day 0 stem cells.
Okay.
I'm way past day 0.
Okay. Yeah.
I'm 60. So how many days is that?
Yeah. There you go.
65.
Yeah.
And so as we age, our stem cells slow down. We don't have near as many. They don't proliferate or multiply like they used to. They're not as effective and efficient. It's called aging, right?
Yeah.
And so as we've aged, PRP, when I use my own stem cells, they don't work as well because they're not
day zero stem cells. Yeah, that's right.
So wonderful research, big body research that shows that about age 30 to 35, our stem cell number in our body and the efficiency of which they work just drops off.
Wow.
So when somebody comes into our office, a lot of times they're going to say, Dr. Jeff, I've had this stem cell therapy before, and they might be my age. Let's say they're 55, 65, 70. I go, well, did they draw the blood and take your own stem cells? I'm like, oh, yeah. And they're telling me that it didn't work. And I go, well, here's why it didn't work. Because I used yours. Let's try some day 0 stem cells. Because there's a good chance that's going to work. I'm much, much better chance.
Yeah.
That's good. Now, we'll still do PRP. We did recently an 18-year-old young man came and had a shoulder injury from playing football.
But that's 18-year-old. 18-year-old. Yeah, that's right. That's right. That's so good. That's so good. So what are all the uses of why would someone consider stem cells at your clinic? Or I know you have other options for people to get treatment different areas. But let's just start with locally. If they're gonna, what kind of symptoms, conditions, problems are you solving with it?
Great question. The weekend warrior, like myself, will come in. People will have chronic pain. It's been going for years. Maybe they've even had MRIs and X-rays in the past. They'll have degeneration in the joint, degenerative arthritis in the joint, knee, shoulder.
Yeah.
They're getting limited range of motion through their joints. They're starting to hurt when you reach up to cover, to get something out of there. The shoulder hurts. They can't do the activities they used to do. Maybe I'm not going to play pickleball. I'm not going to play tennis. I'm not going to play as much golf because my back hurts. And it keeps coming back. I'm good for a while, but it comes back. So back problems, neck problems like I have, people with knee, joint, shoulder issues, people with chronic or muscle joint needs from an orthopedic standpoint responded really, really well.
Is that right?
Preventive medicine.
Yeah.
A lot of times we'll see people that are coming in, they're scheduled for surgery. Their doctor said, hey, you're going on bone. We'll look at the imaging and they're truly not. It's an easy thing to say, bone on bone, that can justify a surgery, or maybe they're pretty close and it's just easy for the person to understand. So the doctor said,
oh, okay, yeah.
And so, but we'll take a look at an x-ray, we'll take a look at an MRI, and it's truly not bone on bone yet. And there's a really good opportunity for us to review the medicine. So we tell our patients, even people that are coming in brand new, let's take a look at what's going on.
Yeah.
It may not be too late for you. If you found, but most of the time it's not.
Yeah.
So
yeah,
it takes things like that. We also get people with chronic fatigue that are coming in all the time.
Is that right?
I love seeing. Well, let me put it this way: a decade ago, or 15 years ago, before we did much regenerative medicine, I did not like seeing the fibromyalgia patient because we had no idea what to do. I mean, they've had everything done.
Yes.
And so now when we see a fibromyalgia patient, yes.
Because you have a solution for them.
Yes.
Yeah.
Which is wonderful. People with arthritis, even rheumatoid, degenerative arthritis, autoimmune disorders, fatigue, things like that, we now have the things that we can do.
Yeah.
Now, people with neuropathies, nerve issues.
Yeah. And that what's so good about you sharing this is that people who have suffered in pain are usually the most skeptical people because, like you, with your neck, you tried everything. You were doing everything. And but if you haven't done stem cell treatment, then you haven't tried everything. And not to push you into it, but it's just definitely something that you owe it to yourself to look into, seeing if this is the right solution for yourself. Do you mind sharing an example or two of like patients, obviously not their names, but like of that they came in a certain way, and then after treatment and therapy, you saw a different person?
Yeah, absolutely. I'll share their names because you can go to our YouTube channel, Local Wellness on YouTube.
Okay.
And their videos are there of them explaining the story.
Okay, great.
And I found that they can explain it better than me.
Yeah.
But, in one particular one, I'm in the hallway of our office with Judy. And Judy came in, she was 79, came into our office in a wheelchair. She was depressed. She was depressed because she was on gabapentin. She was on some other heavy medicine drugs. She was told that she
was she dealing with give me the foot pain, neuropathy.
Yeah, she had neuropathy and real bad degenerative knees and hips.
Yeah.
And she was depressed because her doctor said, "Hey, Judy, you're going to be in that picture."
Yeah.
And like I said earlier,
it's only going in one direction.
One direction.
Yeah.
And it was getting worse for her by the year. She had been in that wheelchair about 4 years, and she said, "Jeff, each year's been worse. I don't know what I'm doing here. I'm here because the last ditch out." She was here for 2
Really?
Yeah.
Wow.
And so, like I said,
who referred her to you? Like, what type of professional?
It wasn't.
Or was it a patient?
It was not a patient.
Okay, great. Like, you might as well go talk to Dr. Jeff and see what they can do. Can't hurt.
Can't hurt.
Yeah.
It's getting worse now.
Yeah.
And so, like I said earlier, probably 15 years ago, I would have agreed with the doctor, like, man, Judy, you're probably stuck in that chair. But now, when you see someone like Judy, we see possibility. Judy, and please go watch. Go watch her video on the YouTube channel. She's walking down the hallway. She's got her cane, and that particular video was the video where she gave me the cane, hung it on the wall.
You're kidding.
And she tells her story of how how she was depressed and she's now walking. Here was the cool thing, man. Her end goal. I asked her for the room, Judy, what's your end goal? What was she? And she said, "Well, Jeff, I want to dance with my grandkids again." And so we know what we were shooting for. So we thought, hey, if we can get Judy dancing with her grandkids again, touch that.
I love it.
And so she had actually been dancing with her grandkids again, and we knew that it worked for her.
Yeah.
Great story. We all know that.
Well, and I think you just have like a couple of really core reasons why people owe it to themselves to invest in themselves. It's a really important element because if there's two things. One, from a physical perspective of most deaths happen because of injury of falls.
Yeah.
And people that when they lose their ability to feel tactile, like on their feet, they're at a higher risk of falling. Okay,
Right.
that's number one. So you helped her through that, right? She's more likely not to. And but number two is the identity side of living and having the purpose. Is I get to her thing was I just want to see myself dancing with my grandkids again. You gave her a purpose and a meaning, and that's pretty powerful.
It's pretty awesome. In our office, you'll get some people think it's hokey, but we wear hope shirts that say hope really big.
Love it.
And our belief is this: if people come in and they don't have hope, we have to start with that. Judy had to see herself dancing again. We have to manage her expectations. If she would have said, "Hey Jeff, I want to go climb Mount Kilimanjaro," I probably would have said, "Judy, I don't know." But for her to dance again and be able to get out of that chair, even if she was going to dance with a cane, at least she'd be dancing.
Yeah, that's right. So good.
But with Judy, she had lost hope. And so for us, let's restore that hope first. Power that made the body heals the body. We know God made our bodies to be well. And at least as well as they can be. Everybody can take a step forward, with their health. And so with Judy, she got hope first. We literally, most of our patients, we make them write that out.
You're right.
Here's my goal. Judy wrote out, here's what I'm shooting for. And then what I loved is our whole team then knew what she was shooting for.
Yeah. Okay. Give me another one.
David White, great guy. He's on. I can use his last name too because he's on our YouTube channel. David is a painter, owns a painting company.
Oh wow.
And couldn't get up and down a ladder because his knees were horrible. David also came in a wheelchair at 48 years old. Knees were shot, scheduled for bilateral knee surgery, and had runaway neuropathy in his feet. And came in as a referral, again from another patient, and was depressed. He tells in his story, if you watch his video, he'd gone through all the medications, and the only thing that was working for him now was medication plus alcohol. So he had to double those up because the meds, he was so immune to them.
Wow.
That's how hopeless that David was. Business was for sale because he said, I can't do it anymore. He had a crew, I can't remember the exact number, I think he tells that in the video, 7 or 8 different crew members that were painting with him. And so David came in and we found out what his goal was. His goal was he wanted to keep the business. He wanted to get his team, his guys that he worked with were a team. They loved each other, they were a family. And so he wanted to keep that camaraderie in that family. And so we started working with Dave. We did exosome flushes. We did some intervention with some injections, neuropathy protocol of stem cell and some work that way. And to this day, David's up and down the ladder, kept his business.
Did he really?
Here's the funny thing. My wife, I get the privilege to work with my wife and my son. And so we had Judy's wheelchair, we had David's wheelchair and some other wheelchairs as our waiting room chairs. And my wife goes, "That's tacky, get him out of the office, Jeff." So she made us get rid of the wheelchairs. But I thought it was kind of cool. But we, to this day, still have his cane hanging on the wall.
Because you felt like they were signs of hope. That's what you told me,
Exactly, So when other patients would come in, I go, "Did you sit in David's wheelchair?" He doesn't need that anymore. Hopefully you won't need yours.
That's right.
And so then we had walkers sitting around and used them as magazine racks and stuff like that. So kind of dorky, but it was also a reminder for us as a team that what we do is important. Everybody has a story. Everybody that comes in to our office has a reason to be there, and they're hurting. Something has taken them out of life. And our job is to communicate with them enough to find out what that is, and give them some hope, and then give them a pathway back if we can.
Yeah, that's so good. What is exciting you most about regenerative medicine right now?
Wow, that's a loaded question. That's a loaded question. One of the things that's really exciting is the rapid rate at which information and real legitimate published double-blind studies are being pumped out to show that it works.
Yeah, that's great.
I firmly believe in my practice lifetime, I probably got another 10 to 12 years left, I hope, of practicing. My hope is that it will be a first step for a lot of physicians. So many surgeries don't need to be done, Ed, and you know that. So many different procedures could be skipped if people would intervene with regenerative medicine first.
Well, it's so interesting because, I interviewed an orthopedic surgeon, and he's all in on regenerative medicine.
Awesome.
So this is someone who did surgeries his whole career, and he's now, a leading regenerative medicine specialist in his area.
That's awesome.
Rather than just going straight to
surgery.
Yeah, and and most orthopedic surgeons, if they realized the power that they have as an orthopedic surgeon, that people will just say, hey, he's an orthopedic surgeon or she's an orthopedic surgeon, I'm going to do what they say. If they understood, that people would just listen to them immediately, I think a lot of them would be switching over right away.
Yeah,
because because what we do is powerful. I think that's probably not as lucrative for them as a surgery.
Oh, there you go.
but it does work.
So let's talk about this. So one of the questions I'm sure you get is, does my insurance cover this?
Right.
And it doesn't.
It does not cover.
Yeah.
It does not
so
cover.
how do you explain to patients about, because whenever I hear that, I always say what are we measuring? The investment in yourself to get the treatment, or are we measuring the cost or the price that it's already cost you?
That's huge.
Over the years of sliding down this place of potentially going right to surgery or not living the life that you were meant to live.
Yeah.
How do you answer that?
Well, that's a beautiful answer you just gave right there. And isn't it funny, Ed, how subtly that sneaks up on us, that losing out on life.
Yeah.
First of all, we start skipping maybe one of our kids' basketball games or something. Then we start skipping this. Then we're missing out on that. Now I'm not going on a family vacation. And that just starts to almost compound, like money compounding. Next thing I know, I'm using a cane or I'm in a walker or something like that. So you asked that good question, what is the cost of missing out on life? Remember how bad my neck was? I wasn't playing with my kids. I got 3 boys at home. They were young then.
Yeah.
I was not able to wrestle with them. I couldn't go out and play basketball with them. I was doing the best I could do to even show up for work and even be there for them at all. I look back at that and I would have paid huge money to get that time back.
Yeah.
But if you want to look at it from a strict monetary standpoint, Medicare says that by the time someone is 70 years old, they're spending $15 a day on drugs, out of pocket. Out of their own money, they're spending $15 a day on medication. Take that times 365.
Yeah.
Take that times 2 years. Take that times 5 years. That's way more than the investment on stem cells are going to be. Because
even surgery, even if some of it's covered with insurance, there's still out of pocket.
Out of pocket.
Fees that come up.
Yeah. The out of pocket costs and surgical costs for deductible copay and medications of copays for a year are significantly more than the investment into stem cell.
Put in proper. And then also just I've always said it too, because I like to golf, but people that, especially like you being in Arizona, you have a very active communities there, but this is true everywhere, which is if you want to go to tennis, pickleball, golf, walking with your girlfriends or buddies or whatever it might be, and you lose that, that's a very dangerous thing to lose, so.
It is. I mean, life is about relationships, right?
Yes, that's right.
And when chronic pain sufferers miss out on life, and I've seen it for 35 years of practice.
That's right.
And it breaks your heart. Yeah. And sometimes they've lost so much hope that even when they see it right in front of them, when we look at a case and we say, because our whole team looks at a case, and we're like, yes, we can accept your case. Yeah. We're gonna take this case on. Even when we give them hope and tell them we can take their case, sometimes they're so down and depressed they can't even see the forest for the trees, and that breaks my heart.
Yeah. You guys, peptides is like the latest big topic of conversation. I know you guys have your own protocols.
We do.
In the clinic.
Yeah, we do. Love peptides. Your body naturally produces them anyway. Just needs a little help now and then.
Yeah.
So a lot of our follow-up protocols, if you will, and sometimes precursor to an regenerative medicine intervention, we'll do some peptide protocols to get the environment ready, to get the body ready for the stem cells to do their work. And then post-injection or post-flush of a regenerative medicine product, we'll follow up with some peptides because that just helps the stem cells work better, more efficiently, keeps the body inflammation at bay. So it's just a whole culture, body culture of preparation and ongoing.
Yeah.
If you can live well longer, why not?
Why not? And so to get this message out, one of the things you're doing is you're doing dinner seminars.
Yeah.
And why did you start that? What's the intention behind it?
A couple different things. It's funny you said that because somebody asked me at the dinner seminar the other night, like, why do you do these things? And I said, well, let me think about that for a second. I go, last 2024, actually, I don't have last year's stats. So 2024, Big Pharma spent $42 billion on TV advertising.
No way.
$42 billion. And I said to the guy who asked me that question, I go, I don't have $42 billion to get this message out there, but I can buy somebody a steak who's interested.
Yeah.
So that was one of the reasons.
That's so good.
Yeah, and the other reason is too, I started thinking about it. We wanted to make getting access to regenerative medicine more affordable for patients. So we went to the lab and said, how do we make it more affordable? And they said, buy in bulk. And we're like, how in the world does someone buy in bulk? And that's kind of where the dinner workshop came in as well, because everybody at that workshop, of all the people that are going to buy in that workshop, if we can make one order of all...
Yeah, we're all winners here.
Yeah. So instead of the lab preparing one vial for one person and they ship out one shipment with just one vial, now it's a group of the power of a group.
Well, the one thing I want to tell you is that, and I want to tell everybody this too, if they are seeing like you're an invite to your dinners or they're looking at possibly going, one of the encouragements I give is that it's such a low risk, no pressure environment for you to get your answers to questions you may not even know what to ask yet.
Right.
But at least like you can come in an environment, and if they decide to become a patient of yours, well, that's amazing. But if you decide not to, at least you gave yourself the right information to make a full decision.
Yeah. I will tell you this, if you come to the workshop, I can promise you this, you're going to have fun. We have a great time.
Yeah.
Learning can be fun. We're making jokes, but we're having fun. We're learning. We're having a good meal. You're going to realize you're not alone. There's other people out there that have the same ailments. Yeah. If you don't want to interact, you can sit in the back. You don't have to interact. But if you do have questions, I stick around, or someone from my team who's doing the workshop sticks around. I'm doing most of them now. We'll stick around. We're going to ask you're going to answer all of your questions.
Yeah.
So it's just a really good resource for someone who wants to come out, look into this, get information, make a more informed decision, and you know what? Get some hope.
Yeah, that's right. That's right. So, okay, Jeff, let's just tell everybody how can they book an appointment with you or find out about the next dinner that you're doing?
Yeah, you can go to our website, which is localwellnesslounge.com. I'm not sure if there's a link below this. You can click on that link.
Yeah.
Our phone number is on there. Call our office. Whoever answers the phone will absolutely know what our workshop schedule is.
Yeah.
Sometimes people want to bypass the workshop and they want to come straight in for an appointment. That's fine too.
Yeah.
You don't have to go to the workshop. Some people are just more like, let's take action, let's go. I want this now.
Yeah,
and so either way, but if you want to come to a workshop first, we would love to have you. It's a great way to make get a relationship started.
I love it. I love it. And so that would be, check out Local Wellness Lounge. Is that localwellnesslounge.com?
.com. Yeah.
Okay. And then, so, I mean, head over, reach out, get your questions answered, come to a dinner.
Yeah.
Or just come right in. Either way, they're going to bring, they'll have a shirt there that says they'll be bringing hope with them on the way in.
Amen. I love it.
Thanks for being a part
Thank
of
you.
the
Really
show.
Appreciate it.
You're the best. And thanks for watching, everybody. And I'll see you on the next episode.